When you have a new practice and are not very well versed in integrative psychiatry methods, what is the best way to introduce it to patients without getting in over your head, especially for an initial evaluation? So I would say the good thing is that you really only need to know enough to execute a plan that day, and then you can always study before you have the next appointment. So I would say the most important thing is less about the specific intervention that you do, and it's more about building rapport and reading the patient properly to understand what they believe is going to work. Because there's a lot of stuff you can do that's basically equally, probably equivalent, but if you pick the one that the patient thinks is going to work, then you're also leveraging kind of the placebo effect, but it's really hope and expectation and the relationship and just the trust that they'll feel that, you know, you're picking a treatment plan that's incongruent with their belief system. So a couple of things. First, it's kind of, you want to establish like what they believe is going to work, but then also, you know, a lot of it is lifestyle modification, and that can really easily get overwhelming too. So you also want to be evaluating like what the patient is, what they feel like they can take on. And so I'll often kind of start by just suggesting like, oh, we can also, you know, some changes we can do in terms of your diet and nutrition that can be really helpful for anxiety. How do you feel about that? And then I'll kind of pause, and they might say, oh, you know, I did like a really restrictive diet and I don't know about that. Or they might just say, oh no, you know, I feel like my diet's already pretty good. I don't know if there's much to optimize there. And it may be true. It may be true that their diet's like 80% good enough, and it's just not the main place that it's worth focusing to make changes immediately. More like if the treatment plan doesn't work, then we'll make some changes. So it's kind of in the context of a dialogue, like asking them like what they think their symptoms are caused by, if they've tried things before that have worked, what have they liked or not liked about treatment they've had in the past. I'll kind of ask those kinds of questions. And I also would say just don't underestimate how the simple stuff feels not simple to the patient. Like they really appreciate it. Like, I mean, even just pull up the depression protocol. In the context of what to do when you're starting is really just the step one of the triage steps is enough for a lot of patients, not treatment resistant patients obviously, but like patients that are relatively treatment naive. Like that's going to be enough for most of those patients. And it includes so much more than just a medication, which is what the patient's used to. Anything that you do beyond just a medication, the patient's going to be, you know, amazed by. Like I found even just something so simple like checking a vitamin D and optimizing it to 50 instead of 30. Patients have never seen that before, let alone looking at like a homocysteine and stuff like that. And it's much more important that the patient gets better than it is that you do a lot. Meaning that if you just do a few simple things and they're better, just don't do anything else. You know, it's easy when you start learning about all the things you can do to feel like you have to do them. But actually the skill set that everyone should be gaining is how to get someone better doing the least number of things as possible, but you've developed good judgment in picking which is the highest yield ones to do based on the relationship, their physiology, you know, all of that stuff.